Hey you guys, it's Angela Marie, your Queen Sickle Cell Warrior. Thanks for coming to my channel. Today we're going to discuss the 4 types of sickle cell, what type of sickle cell I have, what I do to care for myself and stay out of the hospital, the medication I take, knowing your triggers, avoiding your triggers, the new upcoming hydration clinics, the protocols that they will have in place at the different hospitals in Metro Atlanta area, and acknowledging our healthcare providers that do provide quality healthcare to us sickle cell warriors. The 4 types of sickle cell are SS sickle cell anemia, SC sickle hemoglobin C disease, SB sickle beta plus thalassemia, and sickle beta 0 thalassemia. I have sickle cell hemoglobin C disease, and one myth is that a lot of people, including doctors and nurses, believe is that SS disease is the worst one, and the others are mild. But as my hematologist, Dr. Anthony Anyabula, stated that neither type of sickle cell is worse than the other. It depends on the individual and how they are managing their disease. So let's talk about what I do to care for myself and keep myself out of the hospital. I do weekly hydrations, which consist of going to the hospital infusion center and having an IV placed into my veins, and I get 1 liter of D5 fluids, and if I'm in pain, my doctor can put in an order for IV pain meds to help me push through that week. On my off days, I have to balance my time between my loved ones, cleaning, and resting. My daily medication consists of folic acid, vitamin D, Oxycontin extended release, and oxycodone. Many hematologists recommend hydroxyurea, oxybrita, and L-glutamine, which are 3 medications that helps you have normal red blood cells form more frequently. Some people take one of those drugs up to all 3. Personally, I opted out of taking any of those because I am one of those people that do not like taking medicine, and I manage my sickle cell very well without them. Knowing your triggers. My triggers are stress, the weather constantly changing, if it's too hot, too cold, infection, dehydration, injury or pain to a certain area of your body that's not being managed well with pain medicine. So those are the ones that I have to avoid. So what do I do to avoid my triggers? Well, one thing for sure we cannot help is the weather. So I always wear extra layers of clothing so you can always take something off if I get too hot. Dealing with the cold and not having enough clothing can definitely send you into a crisis. Stress. Being in any type of stressful situation, whether it's a relationship, friendship, or a stressful work environment, I will dismiss someone or a situation in a minute because I love myself and life, and any crisis could possibly be your last one. When I say I will cut anyone off, I mean my dad, siblings, cousins, any family, because once again, I love myself and I want to be here. So good news, I have a couple of updates. The hydration clinic in Metro Atlanta area. The first one is Dr. Anthony Anyabula on Upper Riverdale Road in Riverdale, Georgia, will be opening a hydration clinic next to his office in June. Secondly, Southern Regional will be opening a sickle cell wellness clinic. They're looking like August, but no later than the end of the year. With this in place, you will be going straight back to that unit. Within an hour, you will be placed on IV fluids and pain medicine. So no more waiting in the ER. Yes, we've been waiting on that for a minute. Also, all of the Piedmont hospitals are supposed to be getting on one accord with the same process. No more waiting longer than an hour. Within an hour, you have to be back in the back, connected to fluids and on pain medicine. They also have the protocol in place on the floor. So not only would you get the care that you need in the ER, you supposedly will get that same care on the floors with the protocols in place. So maybe this will cut down on us getting treated so badly once you're moved up to the room. Another way to avoid triggers. Well, let me tell you guys this. On my off days, I have no problem with going to get a manicure, pedicure, chilling by the pool, getting a massage, doing whatever you need to do for yourself. Shut down and go away from the world, because your mental health, once it improves, your physical health will improve. When I'm in a crisis that I'm trying to manage at home, I take my pain meds. Every 6 to 7 hours, rest in the bed, drink a lot of fluids, mostly 8 bottles of water, and sometimes I don't even take a phone call. So let's talk about the phone calls. Please, family, friends, loved ones, don't get upset when we send you a text saying we don't feel like talking, we're in a lot of pain. Please don't take it personal. Saying I don't want to be bothered, that's rude. But if we're telling you we're not feeling well and we're in a lot of pain, until you actually go through a pain crisis or ever been in a serious situation where you're hurting all over, you won't really understand what we're going through. So we try our best not to take it out on you by saying, let's talk later. The only thing I can compare the body aches to is like having flu, body aches and pains on steroid, or COVID body aches and pains on steroids. And you know how you feeling like just very fatigued and in pain? Well, yeah, that's what a sickle cell crisis feel like. So once again, if you know someone with sickle cell and they're having a bad day, try to brighten up their day the best way you know how. But if they just say they just need to rest and take their medicine and don't be bothered, don't take it personal. Because let's also talk about the mean sickle cell warrior. Well, I understand you're in a lot of pain. A lot of us are in a lot of pain. But there's no reason to treat people like crap and expect them to treat you nicely. So let's stop with the attitudes. And remember, the nurses and doctors, they have a job. And they're trying to do the best they can to give us the best care. But you have to give respect to get respect. Now, when somebody's mistreating you, let's not get it twisted. I do report people. So the steps are, just politely ask them to leave your room and not come back in. Ask for the charge nurse. When the charge nurse come in, let her know what happened. And another nurse will be assigned to you. Then you just let your fingers do the talking. Email the CEO of the hospital. Let them know what nurse it was, what shift, what he or she work day was, and file a complaint. Let's start putting these nurses, doctors, healthcare workers out there. They are being rude or not doing their job. So let's also shout out the ones that are, such as over at Piedmont Henry Infusion Center, Miss Tracy, Miss Helen, Miss Lorna, Miss Ernestine, and of course, my doctor I've been rocking with for 10 years, Dr. Anthony Anyabula. I am so happy that God put those people in my life. So when you have good care providers, let them know how good of a job they're doing. And if you know of one, put them in the comments so I can shout them out on my next podcast. I will definitely be shouting out the healthcare professionals that are doing a good job just to show our appreciation for them. Well, that's going to be it for this podcast. You guys remember to like, comment, subscribe, hit the notification bell so you will receive the notifications saying I posted a new podcast so you won't miss out. Until next time, together we will find a cure. Love you guys and invite someone to the channel.